liberated on the area like esophageal fistula. The gases will always be liberated, and the gas that you produce will be some oral gas, like you have been constipated, you have constipated yourself. So those are part and parcel of clinical presentation. And another one is difficult controlling bowel movements. You can't control your bowel movements because there is leakage somewhere else. So they just protrude anyhow. In so doing, you experience this kind of things. And that should be a marker indeed that you need to go for medical attention. Recurrent infection. Recurrent infection might be there because these things, they have got created a hole whereby things will be exchanging from this point to another, from that point to another. There is no segregation, and that contamination results into recurrence of this infection. Those are the some of clinical presentation that we observe. But most of the very usual one is unusual bleeding of discharge, which are very foul or gaseous and painful or discomfort. Those are the key markers of fistula of any kind of nature. Yeah.
In case you're just joining us, listeners, in today's episode, we are discussing fistula. So be there and let's learn what Mr. Joseph is presenting here. Now, Mr. Joseph, how do you diagnose this disease to a person?
Diagnosis always be based from clinical presentation, although we can do, for example, physical examination. Physical examination, we can do it by asking the patient the questions in line with the clinical presentation. And we can see if the patient is saying, I'm experiencing foul odor down here, then the speculum is inserted on the vaginal wall so that we can check it, especially where there is a hole. So that's what we call physical examination. And that physical examination is much more based on presentation of the patient. Number two, we can do image testing. Image testing like computer tomography, in case that the patient might have some tumors in the brain or another side of the body. Or we can do MRI, that's magnetic resonance imaging. That again, it helps us to figure out where exactly there might be a tumor or not. Ultrasound scanning can be abdominal ultrasound scanning to figure out if in the abdominal wall there is some tumors or there are some holes being formed because of the condition. Number three, we can do endoscopy or colonoscopy, whereby the tube is inserted inside the intestines. So those intestine in that tube has got a sense to note that the intestine has a hole or not. So if it is not, it is well shown on the screen, and it will give the true reflection of how your colon or endoscopic materials are liberating themselves in terms of or in line with a fistula being attacking them or not. And another method is fistulogram, whereby this is X-ray with a contrasted dye. Patient is given this dye, and that dye is allowed to move within the intestine, and as it is moving down, where there is a hole, it will tell you that on position of such X, there is a fistula. As such, you deal with that kind of, you deal with that part that has been affected. So those are the 4 areas that we always use. But most of the time here in Malawi, we depend on physical examination as well as imaging tests. That's how we can diagnose fistula.
All right. So, is there any treatment for this fistula?
Yeah, fistula can be treated, but most of the time the treatment is surgery. we do fistulectomy or fistulectomy. So fistulectomy is a process whereby we remove the part that has been affected and align it. That's what we call fistulectomy. That is done through surgery. Or we can do fistula repair, whereby the hole that has been affected, it is sutured so that it is well controlled, so that it should not leak any more contents on that kind of affected parts. And again, where they have got infection, we can provide antibiotics, and those antibiotics must be in line with how the full blood count of the patient is liberating. When the patient has got a lot of WBC count, that means a strong antibiotic is prescribed according to the drug prescription orders. Another treatment is biorest or dietary changes. I said already that this fistula might come because you are not following healthy hygiene, whereby you are failing to take a lot of water. You can develop constipation. So those constipation might put a lot of pressure on your bowel, and that bowel has got a risk of developing a hole. And if you develop a hole, then you have developed a fistula. As such, sometimes it is important that you eat a lot. But you take a lot of fluid so that your fecal matter should not be too hard. So if they are soft fecal matter, they are easily get rid from the bowel. But when they are too strong, it's very difficult. And when you are trying to remove them via natural way, it becomes very difficult. As such, you stretch other muscles, which might predispose you again to developing these kind of things. In addition to that, we can do some drainage or catheter placement. When we say catheter placement, we put where there is a protrusion outside the skin. We can put a catheter that it should carry those fecal contents or any contents from that side into the catheter bag. And most of the time we call it Bogoda bag when we have got the contents there outside the body. We put the Bogoda bag so that it can be well secured. And the fecal diversion, we call it colonostomy or ileostomy. In this case is whereby the contents of in this case, let's say for the colon, they are being diverted. The colon is the colon bag is inserted on the colon. From there, then those fecal contents, instead of contaminating the another parts of the body, it will get into the colon bag. It's a matter of just to divert them, that they should not contaminate another part of the body. Those are some of the treatment that we use when we are dealing with fistula as a condition. Yes.
All right. So, as we are going to an end of our program, let's look at the complications now of this medical condition.
The most complication of this fistula, as I said, fistula most of the time attack childbearing age women. Most of the time is an obstetric condition. So the most complication is emotional or psychological distress. They said that the woman might be producing foul odor discharge. So those kind of things, they just come without you realization. In the end, when you are on the group of people will be a bit puzzled because of the foul discharge, and you become embarrassed, and thus create emotional and psychological distress. That's very, very emotional. And organ damage or failure, as I said, that this can happen during even on the trachea, even the brain, even the cancerous cells. So those kind of things, if it is not well taken care of, the organ might damage or might fail to function to its functionality. Another thing is narrowing or stricture. Narrowing will come because I said that if the colon is experiencing a lot of pressure, the longer last it will narrow. It won't be performing, or its surface area will get strictures and narrow. As such, the functionality will get a bit lower. Then you can have fluid retention as well as abscess. Fluid collection can be at a certain point whereby it can be in the colon or the trachea or any other part where the fissure has taken place. You can form those kind of fluid collection, even abscess, and the longer last you might be able to develop infection. So infection can develop because there is contamination between one part of the body of one to another. As such, infection or even sepsis might result. Those are some of the complications of fistula of any kind of nature.
Let's finish prevention. How can someone prevent fistula?
Fistula can be prevented by number one thing is we need to have safe surgical practices. We need to have experts in terms of surgical practices, because most of the time these fistulas they are being created by lousy medical practitioners, whereby we fail to do safe surgical practices. We don't need to pierce other organs of the body instead of being straight to the point to deal with the organ that is really indeed of important. We need to have proper wound care. Proper wound care will help us not to develop infection. That infection, if the infection is chronic, the chances of getting the fissure is very high. For example, if you have got a wound at the trachea, then the medical people, they are not taking care of it well, it end up having some what we call a chronic infection. That infection might pierce to other part of the body, and that creates formation of fistula. In addition to that, we need to have timely treatment of infection. Where we feel that we are experiencing this kind of clinical presentation I put above already, we need to have time that we have to seek medical attention as early as possible so that we can prevent infection which predisposes us of catching this fistula. In addition to that, lifestyle habits. Lifestyle habits shall entail, as I said already, that water is very important. Water will help us to make our fecal contents to be soft enough so that when we are having the urge to do the calling of the nature, we should not be struggle of releasing them. When we are not taking out of water, we put us on the position of developing constipation. Constipation will result into pressing much on the muscles of the rectum or any other part of the body that might put us on the risk of developing fistula. Another thing is regular checkups and screening. Where we have experienced something else, like the clinical presentation that I've said, you are feeling some discomfort or pain, you need to go for regular checkups. So, and I insist for screening. You need to be screened in all other areas where necessary, so that you can rule out that indeed it is a fistula or not. So those are the areas that we need to prevent, so that we are safe from fistula of any kind of matter. So that's how I can say about the fistula in a very summarized manner.
All right, let me thank you again, Mr. Joseph, for coming here and teach us more and teaching us on how